At 8:16, 5 on your health this morning, feeling the first signs of a stroke.
For some people, it is a sudden and severe headache or weakness on one side, but other symptoms may be much more subtle. Joining us now is Dr. Nirav Patel, a neurosurgeon at Brigham and Women's Hospital. Doctor, thank you so much for joining us this morning to talk about this really important topic. We want to show some kind of frightening video of a healthy 38-year-old woman. She's suffering a stroke. This happened in her bedroom. She was making her bed and she lost her balance. As you can see, she stumbles to her side and then she fell to the floor. Fortunately, she was able to use Siri to call 911, thankfully. You've talked with a lot of survivors, of course. How many of them realized right away they were actually having a stroke and called 911?
Well, thank you, Rondell and Jennifer. Thanks for having me. I think it's such an important question because identifying the stroke is the first step to getting it cured or hopefully fixed as fast as possible. Not everyone does, but it often comes down to family members, friends, realizing someone's having a facial droop, the arm's not working, have a bad headache. And that really means call 911. Much better to just call when you think there's something terrible going on.
Absolutely. And once they're at the hospital, how do you confirm whether they've had a stroke or not, or they have TIAs? Like, what's all the difference?
Yeah, wonderful question. You know, this is the revolution of our lifetime, medical stroke care. Patient gets to the hospital via family member, ambulance. Once they get here, though, time is ticking. We're getting a CAT scan. We're looking at the arteries of the brain. Two kinds of stroke out there, where one artery closes, not enough blood gets to the brain. Another kind where the artery bursts and there's a rupture. That's about 20% of the time, and it's the number one in young people. Often we see that. For an aneurysm, an AVM is a rupture, whereas an ischemic stroke is where the pipe closes. We make that determination and then get to the patient and get them to the next correct step.
I have a question for you, actually. So when you hear like a severe headache, how could someone tell the difference between like, oh, I just all of a sudden have a really bad headache and one that may indicate a stroke? And is there anything that we can do to prevent having a stroke? What should we do to prevent?
Great question. Both great questions. You're right. We all have headaches. There's 250 kinds of headaches. The kind of headache we're talking about, sudden, severe, worst headache of life, you've never had it, right? Someone hits you in the back of the head with a sledgehammer. That's a terrible headache. That's something to call ER 911. How do we prevent stroke? Well, a lot of it, when it's ischemic stroke, the pipe closing type of stroke, is just lifestyle. Exercise, eating right, keeping the cholesterol down, taking the medications that work when necessary. Whereas the other kinds of stroke, like an AVM, where someone's born with it, well, that's not something you can prevent. That's something that gets found, and both kinds can be treated.
What's the difference between a stroke and a TIA, or are they the same?
Right, great question. TIA is transient. It means it happened and then it went away. It didn't leave a lasting deficit, whereas a stroke can be something that an arm just never gets better. When we hear either one, though, we're going to triage it, try to figure out, is this the kind that we need to take to the operating room? For example, the kind that where a clot might fly up from a carotid up into the brain. Now there's an ischemic stroke. That's real bad. Large vessel occlusion. We're now at that revolution where we can take a catheter up through someone's leg or wrist while they're awake, pull that clot out, and sometimes they can walk out of the hospital without injury. Whereas the TIA might be treated long-term. Once we know it's not the dangerous sort of thing, we'll figure out a different solution for that.
Oh, Dr. Nirav Patel, thank you so much. It's all so scary. Your clarification provides some sort of comfort. We thank you, neurosurgeon at Brigham and Women's Hospital. Have a good weekend.
Thank you. Thank you, you too.